most famous physical therapist on the internet.
Howdy, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And then wake you
therapist.
up. Together we are the most famous physical therapists on the internet.
And our opinion, of course, Bob.
Today we're going to talk about 3 gentle stretches to reduce knee pain. We've had some pretty good success with some of these. Actually, my wife even had good success with one of these.
You help her out sometimes, huh?
Oh yeah, and she was actually having. It seemed like it involved the meniscus or the cartilage. So when you can start altering that a little bit, that says a lot. By the way, if you're new to our channel, Brad, please take a second to subscribe to us. We provide videos how to stay healthy, fit, pain-free. We upload every day. And also, we got some options here, Brad. Now, there's 2 reasons why you're going to want to join us on social media. One, if you're tired of our long version of these,
all the babble.
Yeah, all the babble. Go to Twitter or Instagram. We got the shortened version of what we do here. And also, if you want to win something, you want to go to Facebook, Bob and Brad. It's pinned to the top of the page, or go to bobandbrad.com. It's always under the giveaway section. What are we giving away? We don't know because it's tomorrow, right? What are we giving away tomorrow? Renfo back massager.
Really?
That's really cool.
Yes.
So join us. If this is the first day it came out, take a look.
Can we get on with the show now, Bob?
Sure. Let's.
All right. The knee, gentle exercises. It's nice to do things that's gentle, that achieve the goal.
Not aggressive.
Right. And that's what people think, that physical therapy is always means something aggressive or painful.
That's how we get physical terrorists. PT. So.
Pain and torture.
But also I also heard physical terrorists.
Yes, well, those are inside jokes that all therapists know, but other people may not.
Right.
So we better go on. The first one, now this is one that is really nice, and I'm going to show you what you'll want to do. Is we broke this down to 3 components, and the first thing, a good source of pain for a lot of times is the kneecap or the patella. So get in a chair like this, a recliner or a chair where you can get your legs straight and relax it, because it's really critical that your quadriceps are completely relaxed for this stretch. And the reason why is the quadriceps connect directly to your patella. They're part of the tendon, actually, and then it connects here. But when they're relaxed...
The patella is your kneecap for...
Oh, yeah. Thank you, Bob. Yeah, good point. So I'm going to change position now so you can see how I'm moving it, because it's easier. But this is a position you'll want to do it. I'm going to show you in this position so we get that top view. So I'm going to relax my kneecap or my quadriceps, see, all jello. And I'm going to grab my kneecap like this, and I'm going to move it up and down. Now, a healthy kneecap should have a lot of movement there. You should be able to move it up, and it's kind of hard to see. If I took my skin away, you could move it, but I'm at the base of my kneecap. I'm moving it this far up, and then I'm going to move it that far down. So it moves, I would say, over a ½ an inch.
Yeah, and there's people that this really makes them queasy to do this, but it really... especially if it's tight, it really can serve benefits because if it's the kneecaps really tightened globally, as we say, it's really pushing against, it's a joint itself, and it can cause stress and grinding and pain.
Yeah, and you can have some arthritis near that. This can help work out a little bit. Then you do that for about 30 seconds, and then you go right to left, or I'm sorry, right to left. Back and forth, and you can see there's a fair amount of movement. Now, sometimes it's common that on the outside, the lateral part, there you can get a tight fascia there. What's that? The term they technically use for that syndrome?
Patellofemoral syndrome.
No, I'm thinking of another lateral. They do a lateral release for it as a surgery.
Right, exactly.
Right. So you want to make sure you get full motion back and forth. If it feels a little tight or it's a little painful, but after you do it for 5 or 10 seconds, it starts to feel better, then I would continue to do it for 30 seconds. And that goes for all of these. However, if you do it and after 5 or 10 seconds, it seems like it's getting worse, then I would back off from it.
Now, this really is for a specific problem like patellofemoral syndrome.
Sure.
I mean, you may have a little bit of this with arthritis too. So this isn't one that necessarily is going to take away your pain unless you have that problem.
Right.
But it certainly isn't going to hurt
if
you're,
Exactly.
Right.
So you go up and
it's
down
always good
30
to have the
seconds,
mobility.
right to left for 30 seconds, and you can try some diagonals.
You can do angles,
Yep. and do that direction and then that direction. So that'll take you, a
But you
couple
can see that
minutes.
yours is very loose and no
Oh yeah.
problems there at all.
Yep,
So
feels good. All right,
yeah.
next one. Should we show them the next one, Bob?
Sure, why don't we do that, Brad?
Okay. See now this one in a chair. It's nice to have a stool that rolls. It makes it a little bit easier. And if your knee is painful and you want to stretch it to get full motion, because that can relieve the pain oftentimes, is we want full extension. If you see the stripes on the pants, now I'm fully straight. That's a good healthy knee. If you go down like this and you can feel it's not going fully extended, then you may want to do some extension mobs or stretches. You don't want to push on your kneecap, but just above it and gently stretch. And you could see the advantage of having a stool with wheels because it just makes this much
That may
smoother.
be too high for some people. Some people might have to start a lot lower
Yeah.
with a lower stool
You
or
might
down
just be
like
able to go
that,
like
right?
this, and that's more gentle because there's the title of the of the
Right.
episode.
And seriously, if you have even a slight lack of extension,
Hmm.
if you compare the two knees and one knee straightens out all the way completely and the other one has just a slight bend,
Yep.
you still should absolutely do this
Yep.
exercise because this is what my wife had, and she had just probably almost imperceptible
Yeah.
lack of extension, but she would do this and it would feel better.
Sure.
She would do
Yep.
this, and she'd do it also when what you're going to mention about the 12 o'clock and 2 o'clock. She did it
That
at 2 o'clock.
okay. That's what we're talking here.
Yeah,
The option here, if you look at my toe, I'm going to call that 12 o'clock. And if that would be 2 o'clock and this would be 10 o'clock, all we're doing is we're rotating a little bit and then you do the exact same stretch. And if you find that this way or this way you get better stretch or it feels better, then go the
or
direction.
more pain relief.
Yeah.
I mean, she actually
Yep.
felt better when she was doing this, and this is one that, with in her case, I'd have her do it like 10 times.
Sure.
Then, like an hour later, she'd do 10 times
Yep.
again. She'd do it at her desk another 10 times. Throughout the day. And
What about through the evening? Did you ever get out of bed and do
no,
it?
no, no. Once she's in bed, that was over.
Red to draw the
Yeah,
line there.
yeah.
Just a poor humor there. Anyways, the next one is
What's funny is your socks, by the way.
those are
Those are
nice
like dad socks.
I've had these socks for a long time and they hold up well. Got them for a Christmas gift,
All right. You wear them with sandals too?
Bob.
All right. What are we
Hey,
doing?
why, Bob? Why? We always get carried off into some tangent. Now, the next one, you can do this one seated. You want to show them seated, and I'll show them
Sure.
laying down. I think this one for a lot of people might be more relaxing or easier
Yeah,
to do
so
seated.
you're gonna just grab right underneath the knee here, and I'm gonna work on trying to get a little more bending now. And it's the same as the extending. If one knee tends to go back a lot further than the other one, and the painful one doesn't go back as much, you want to regain that motion. So here I'm under the knee, and I'm doing pressure on, pressure off, pressure on,
So
pressure off.
I'm doing the same stretch except for laying down. You could do this in bed without any problem. It works well.
Yeah, and what's nice about this is you can do it just about anywhere. You can do it at your office. I even don't go up to, some people like to do it on a staircase, and
Oh,
they'll put it
sure.
up on
Put
the
some
stairs.
body weight.
Yeah, a couple stairs, and they'll do pressure on, pressure off like this.
It's all going to depend on the individual, how sore your knee is, maybe how old are you, or if you're unstable. Someone that's not very stable on their feet, that might not be appropriate, but this might be. And you can also take a towel roll. Some people have a hard time reaching all the way over, and maybe their knee doesn't flex very much. It gets to here, and then you can use that for that pressure
To
on.
provide a little
Yep,
leverage.
little extension there of your arms, so if you will. And all these you're going to do maybe 10 to 15 reps, and then repeat them as long as you get better range of motion. Pain is feeling good while you do it, and afterwards you can do them multiple times a day.
Yeah, real simple to do, but always again let pain be your guide, because again we're looking at trying to reduce knee pain, not increase it. So
Right.
it should give you that sense like that. This is right. This feels
Right.
good.
It's feeling better every
so-
time I do it,
All right. Thanks everybody for
Right.
watching. Remember, Brad and I can fix just about anything.
except for
A broken heart.
there you go. But we're working on it, and we will
we can
continue.
give a relationship advice. I bet. Maybe not. I guess not.
We could try.
We could try. Thanks for watching.